A very warm good morning to respected Principal Sir, Vice Principal Ma'am, teachers and all my dear juniors. Myself Neelu Mishra and I am the student of BSc Nursing 4th year, and today I will take your Amazon lecture, and the topic of Amazon lecture is Raynaud's disease. So before starting the class, I would like to say that students, if you are having any queries or questions regarding this disease condition, you can send a voice message or text message in this group. So here we start. So before starting the introduction, I would like to say a few points regarding this disease condition. Raynaud's is first discovered by Maurice Raynaud in 1862, and by the name Maurice Raynaud, this disease get the name Raynaud disease. This disease mainly affect the arteries, and you all know that arteries carry the blood from the heart and supply the blood to all over the body parts. Now the introduction. Raynaud's is a rare disorder that affects the arteries. Raynaud's is also called disease, syndrome and phenomena. Raynaud's phenomena is a form of intermittent arteriolar vasoconstriction that results in coldness, pain and pallor of fingertips and toes. Raynaud's is a rare disorder that mainly affects the arteries, and it is sometimes called disease, syndrome and phenomena. Raynaud phenomena is a form of intermittent arteriolar vasoconstriction. It means that there is regular episodes of arteriolar vasoconstriction. The vessels get constricted, or here vasospasm can also occur, means vessels get narrowed, and due to that the blood supply get altered, and due to the alteration in the blood circulation, the blood supply get reduces in the fingers and arteries, in the fingers arteries or toes arteries, that results in coldness, pain and pallor of fingertips and toes. Now the definition of Raynaud's disease. Raynaud's disease refers to a disorder in which the fingers and toes suddenly experience decreased blood circulation. In Raynaud's disease, there is the vasoconstriction occur, means the vessels get constricted, or the vasospasm occur, means the vessels get narrowed. Due to that, the alteration in the blood supply that suddenly experience decreased blood circulation in the fingers and toes. The term Raynaud's phenomena is used to refer to localized intermittent episodes of vasoconstriction of small arteries of feet and hands that cause temperature and color changes. In the Raynaud phenomena, there is a localized intermittent episodes of vasoconstriction, means there is regular episodes of vasoconstriction. The small arteries get regularly constricted of feet and hands that results in temperature and color changes in the small arteries of fingers and toes. This disease rarely affects the nose, ears, lips and nipples, and it mainly affects the feet and the hands. Now we will study about the causes and types of Raynaud's condition. Normally the blood flow from the large arteries into the medium size or muscular arteries, and then into the small arterioles, which carry the blood to the capillary bed. All artery vessels have three layers. From inside moving out, there is the endothelium, then the medial layer, which contains the smooth muscles, and finally the advential layer, which have the loose connective tissue and nerves. Some nerve fibers in the skin function as thermoreceptor, which sense changes in the temperature. When stimulated, they cause the nerve to fire, sending signal up to the spinal cord to the hypothalamus, which is at the base of the brain. The hypothalamus serves as the body thermostat because it coordinates the brain's response to temperature changes. The hypothalamus is what triggers the thought, "Hey, it's pretty cold. Maybe I should find a friendly llama to snuggle with the warm." The hypothalamus also coordinates changes in sympathetic and parasympathetic nervous system. For example, normally there is a lot of heat energy in the blood that get lost to the environment. When the sympathetic nervous system gets stimulated, it causes contraction of smooth muscle that wrap around arterioles, causing vasoconstriction and reduction of blood flow to the skin that shunt blood away from the skin and towards the body core or organs where less heat energy is lost. In Raynaud's phenomena, triggers like cold weather or even emotional stress can cause the sympathetic nerves in the wall of arterioles to get overstimulated, and that makes the arterioles vasoconstrict. If the vasoconstriction happens briefly or intermittently, it can cause the vasospasm. When the arterioles vasoconstrict, it dramatically decreases the blood flow to the downstream tissues. For example, if there is vasospasm in the arterioles in the fingers, it causes the finger to turn white, reflecting ischemia, then blue, reflecting hypoxia, which is low oxygen state that occurs after prolonged ischemia. Finally, once the vasospasm and oxygenated blood rushes into the tissues, causing what causes the reactive hyperemia, which makes the finger looks red. This rush of blood is thought to be the cause of swelling, tingling, and pain that some people experience at this point in the episode occurs frequently. Now there are few important differences between the primary and secondary Raynaud phenomena. Primary Raynaud phenomena usually affect the fingers and toes symmetrically, and severity stays roughly constant over time. The arteries themselves typically remain undamaged unless the episodes occur frequently over many time, in which case there may be some thickening of the arterial walls. The most common triggers are stress and cold temperature, but other potential triggers include nicotine, caffeine, and as well as the medication that affect the sympathetic nervous system like pseudoephedrine. Primary Raynaud phenomena is common among pregnant women and is common among those who are working in the job that requires lots of vibration, like using a jackhammer. In contrast, secondary Raynaud phenomena usually affect fingers and toes asymmetrically, and there is often progressive severity because there is often underlying damage to the arteries. It is also often associated with the connective tissue disorders like systemic lupus erythematosus and scleroderma, as well as the vasculitis like Buzzard disease and Texosu arteries. Now students, we will study about the risk factors. As you all know that risk factors are not the leading cause of any disease condition. These are the factors that worsen the condition. So the factors that worsen the Raynaud's condition are: first one in primary Raynaud's, gender, family history and living climate. So first we will study about gender. In gender, approximately 80% women are having primary Raynaud's. So as compared to men, the women are having more condition of Raynaud's disease, and women are likely to occur Raynaud's disease as compared to men. Next one, family history. So if any family history of Raynaud's condition is there, so it may be likely to occur in the offsprings also. Next, living climate. So in the living climate, if the person is overexposed to cold climate or the cold temperature, so it may be happen the person will get the Raynaud's condition. Now the risk factor of secondary Raynaud's: certain medication and caffeine, certain disease conditions, injury to hands and feet, occupation and smoking. Now we will study one by one. Certain medication and caffeine. Certain medications including the drugs used in ADHD, attention deficit hypertensive disorder, example Ritalin, beta-adrenergic blockers used to treat the high blood pressure, and ergotamine that is used in migraine headache and amphetamines. These drugs can cause the vasospasm and may be lead to the Raynaud's condition. And the use of caffeine also, like coffee, can also lead to the Raynaud's condition. Next one, smoking. Smoking can also cause this vasospasm and vasoconstriction in the arteries and alter the blood supply and can cause the Raynaud's condition. Certain disease conditions including skin vasculitis, scleroderma and carpal tunnel syndrome etc. can cause the Raynaud's condition as they alter the blood supply and damage the blood vessels and lead to the Raynaud's condition. Next one, injuries of hands and legs can also lead to the Raynaud's condition as they damage the blood vessels and can lead to the Raynaud's condition. Next one, certain occupation including jackhammer and typewriter. If the person is a jackhammer, so he will expose to the vibration, and if the person is the typewriter, he will have the repetitive physical stress so that the fingers may go into the spasm and there is intermittent lack of blood supply to the fingers that can lead to the Raynaud's condition. Now we will study about the pathophysiology of Raynaud's condition. So, due to the etiological factor, for example, connective tissue disorder, certain medications, genetic disease or condition, exposure to cold and stress. Connective tissue disorder including the systemic lupus erythematosus, scleroderma, etc. Certain medications that are used in the migraine or to treat the high BP or the drugs that are used in attention deficit hypertensive disorders can cause the vasospasm and can cause the Raynaud's condition. And the genetic disease can also lead to the inheritance of the disease condition to the offspring. Next, due to any etiological factor, the vasoconstriction and vasospasm occur in the arteries. As you all know, vasoconstriction is the constriction of blood vessels and vasospasm is the narrowing of the arteries. Then there is the pooling of deoxygenated blood that cause cyanosis due to the deprivation of oxygen. So, due to the vasoconstriction and vasospasm, there is a pooling of deoxygenated blood in the arteries that cause the cyanosis, and that is mainly due to the deprivation of oxygen. Next, due to the deprivation of oxygen and cyanosis, next step will occur. There is a result of X-aggregated reflow of blood that cause hyperemia due to the vasodilation. After vasoconstriction, there is the vasodilation and that cause the hyperemia. Next one, red color occurs or produced when oxygenated blood return to the digital arteries after vasospasm. So after the vasospasm, the red color or the crimson red color produced in the arteries when the oxygenated blood return in the digital arteries. So when the fingers get reddish in color, after that the person will feel numbness, tingling, burning pain and cyanosis and redness in the Raynaud's condition. Now we will study about clinical features of Raynaud's phenomena. In Raynaud's phenomena, the triphasic color changes occur in sequence or stages. There are mainly three stages that occur in the Raynaud's phenomena. These are first stage, stage of blanching, second stage, stage of anoxia, and third stage, stage of red engorgement. These are mainly three stages that are present if the person is having Raynaud's phenomena condition. So we will study detail about this first stage of blanching. In the stage of blanching, when there is exposure of cold, the spasm occur in the digital arteries and the digital arteries are present in the hands, and due to the spasm, the blood flow is stopped in the digital arteries or blood supply get altered in the digital arteries. So it causes pallor in the fingers of the person. As you can see in the picture also, the whitish color occur in the fingers, and the white color or the pallor start from the tip of the finger and the person experience numbness in the fingers. Now the stage of anoxia. In the stage of anoxia, there is a pooling of deoxygenated blood during vasospasm. So, due to the pooling of deoxygenated blood in the fingers, it causes cyanosis, and you can see in the pictures the fingers get bluish color and cyanosis occur in the second stage, that is stage of anosmia, and the patient suffer from numbness or cold in the fingers. Next, the third stage. Now in the third stage is stage of red engorgement. In this stage, when the spasm gets fully relaxed and the blood supply gets normal in the fingers or the digital arteries, so the hands or the fingers become reddish color, that is rubor. So these are the three stages that are mainly occur in the Raynaud's phenomena, that is stage of blanching, stage of anosmia, stage of red engorgement. As we studied that in the first stage of blanching, pallor occur. In the stage of anosmia, due to the deprivation of oxygen, cyanosis occur, or in the stage of red engorgement, when the blood supply gets returned, rubor occur. So these are the three stages that are mainly occur in the Raynaud's phenomena. Now in the severe cases, ulcers in the tip of the fingers and toes that are mainly occur in the severe cases of the Raynaud's phenomena, and stinging, throbbing pain or tingling are mainly occur in the toes or fingers if the person is having Raynaud's. Now we will study about the assessment and diagnosis. It includes the complete history, physical examination, cold stimulation test, nail fold capillaroscopy, digital artery pressure, Doppler ultrasound, complete blood count, blood test for urea and electrolytes, and autoantibody screen test. Now first one, history collection and physical examination. We will assess the history of the patient and assess for family history of cardiac and vascular disorder or the connective tissue disorder and the history of hypertension. We will also assess the occupational history of the patient, age or any family history of any Raynaud's condition. Next one, we will assess the physical examination of the patient from head to toe and check the color changes in the extremities, especially in the fingers and the toes, and should monitor any sign of loss of sensation. Cold stimulation test. A cold stimulation test can be used to trigger Raynaud's symptoms. For this test, a small device that measures temperature is taped to fingers. Hands are then exposed to cold. They are usually briefly put into the ice water. Hands are then moved from the cold and the device measures how quickly fingers return to their normal temperature. If you have the Raynaud's condition, it may take more than 20 minutes for finger to return to their normal temperature. These type of ice cubes are used for the cold stimulation test. Next one, nail fold capillaroscopy. For this test, doctor puts a drop of oil at the base of the fingernail. He or she then looks at the fingernail under a microscope. If doctor sees an abnormal arteries, it may mean you have a disease linked to the Raynaud's condition. Next one, digital artery pressure. Pressure are measured in the arteries of the fingers before and after the hands have been cooled. A decrease of at least 15 mmHg is diagnosis for the positive Raynaud's condition. Next one, Doppler ultrasound. It is mainly done to assess the blood flow in the arteries. It's the nail fold capillary microscopy that is the diagnostic procedure we will have study in this. Next one, complete blood count. This can reveal the normocytic anemia, suggesting the anemia or renal failure condition. Next one, blood test for urea and electrolyte. This can reveal the renal impairment, or next one, thyroid function can reveal the hypothyroidism in the person. Next, an autoantibody screen test. that is done for rheumatoid factor, erythrosedimentation rate, C-reactive protein, which may reveal specific causative illnesses or a generalized inflammatory process that can lead to the Raynaud's condition. Now we'll study about the management. First, lifestyle modification, then pharmacological management. In lifestyle modification, avoid smoking. We'll say the patient to avoid smoking. So smoking can cause decrease in the skin temperature and increase in the constriction of blood vessels. So we'll say the patient to avoid smoking. Next, regular exercise. Regular exercise can increase the circulation throughout the body and help for vasodilatation. Next, control stress. We'll say the patient to avoid stressful condition or control stress that will help to prevent the hypertensive attacks and prevent from narrowing of blood vessels. Next one, avoid caffeine. Caffeine can cause the constriction of blood vessels, so it should be avoided. Next, take care of hands and feet. If the patient is having Raynaud's condition, so he or she should give care to the hands and toes and prevent it from injuries and avoid wearing tight dresses. Now we will study about the pharmacological management of Raynaud's condition. In pharmacological management, first, calcium channel blockers. The calcium channel blockers help the blood vessels to dilate in the hands that are first example amidine and nifedipine. These are mainly drugs that are used in the Raynaud's treatment. Next one, sympatholytic agents. The drugs that can interfere with the effect of certain types of nerve transmission. For example, risperidine, doxazocin and methyl dopa are widely used in the treatment of the Raynaud's condition. Next, topical glyceryl trinitrate. Nitroglycerin ointment is effective in the patient with a primary Raynaud disease and limited cutaneous systemic sclerosis. Next, botulinum toxin injection can inhibit the release of epinephrine or non-epinephrine in the nerves that inhibit the smooth muscles and blood vessel constriction. So these injections are used for the inhibition of smooth muscle cells. The surgical management. In the surgical management of Raynaud's condition, sympathectomy is done. In this, as you know that sympathetic nerve in hands and feet control the opening and narrowing of the blood vessels. So in the sympathectomy, there is the cutting of these nerves that interrupts in the X-aggregation response. It reduces the frequency and the duration of the attack of the Raynaud's condition. In the sympathectomy, interrupting the sympathetic nerves by removing the sympathetic ganglia or dividing their branches such as reserpine, prazosin may be helpful. These are the drugs that are used for the sympathectomy. Next one, nursing management. In nursing management, first one will minimize the sensory alterations. Next, relieve the pain of the patient. Third one will provide the education and will guide the person about the health maintenance. Some other nursing management include the client is encouraged to avoid exposure to cold. Then will avoid repetitive hand movements and stressful situations. Next, will advise the patient to quit smoking and avoid secondary smoke as nicotine is potent vasoconstrictor. Will say the patient to use the stress management techniques, example biofeedback, assist in alleviating some distress from the condition.